Good morning, good morning. And there she is. There she is. She didn't want to hear the intro. She didn't want to hear the intro. So we are live. I popped on live because 200 people were knocking down the doors. Vivian, good morning.
Good morning. Can you hear me okay? Or is it too loud? I can adjust it.
Is it fair to say, I mean, you're all mic'd up. You look great.
No, but
Everything's
how does it
fantastic.
sound? How does it sound?
Can we do a sound check?
Well, how does it, I don't know.
Can you sing maybe a little piece of opera for us and then
I don't know if I can sing a little piece of opera.
okay. Happy birthday or the
No, you're
rainbow
gonna have to just
passage.
hear me speak. Okay, I'm not gonna sing. I'm terrible at singing.
I was going to say, this would be a much nicer conversation if we were sitting at the evening after some workshops over a glass of wine in the lobby, but it's too early for that.
Yeah,
some
but I do have
people.
my coffee though. I have my coffee.
Well, I'm going with some lemon ginger tea,
Oh, okay.
the
Yeah.
double tea bag. But your headset, I mean, that headset just says one thing. You're talking to someone who's TED Talk level. We're talking the greatest spokesperson currently for stuttering. And so without further ado, let me just do a quick intro here. Great to see everybody. Good morning. It's Uri Schneider. I have the privilege to lead at Schneider Speech with my father, Dr. Phil Schneider. And we've got some exciting things going on, but the most exciting thing, and I'll share the other things towards the end, so hang in. I'll talk about the AirPods we're giving away. And if you pay attention, if you find something Vivian says that's awesome, write it down and notice when she says it, because you can send that to us and that gets you into the raffle to win the free AirPods. We're trying to create a highlight reel for the end of the year episode. So if you help us grab a piece, because I can't possibly re-listen to all the gems. It's like a mountain of wisdom. And if everybody could help us, we'll all pick out what was meaningful to us.
That's a lot of pressure. That's a lot of pressure, Uri.
There's no pressure. Listen, I pulled out some gems. I re-listened to so many of your talks, Vivian, in the past week. I have you coming out of my ears. No. I thought though maybe you were avoiding coming on this morning, but I'm glad you did.
The actual truth was I could not find the invitation in the email.
I know.
Yeah.
I have to get better at like locking things in with that.
Well, maybe a reminder the night before with the link. Yeah.
100%. 100%. Listen, it's a work in progress. This is all like an accident. So yeah, it's not like we had to schedule this, I think 4 months ago. I think like you were one of the first people. I was like, okay, so it was nice doing this with the first person. I'd love to talk to Vivian. She's like, oh, that'd be lovely. My calendar's a little full. I think I could squeeze you in 2020. Let's see what we can do. So it's a privilege.
It's still 2020.
Well, yeah, we're gonna finish strong. So I'll finish the nice things. But yeah, so we're giving away the AirPods because we want to just put together this highlight reel. We're giving away the online course just as like a spirit of giving this season of the year for people to see what they can do if they choose, whether you're a speech therapist or a teen or adult, to kind of dive into the Transcending Stuttering online course. We'll give the details later in the comments, but you're not here to listen about that. You're here because Vivian Sisskin is someone who most of us know, and to know her is to love her. She stands out besides all of her boring intro accomplishments, which are not unremarkable, both at University of Maryland, also the Sisskin Center for Stuttering, what she does with the avoidance reduction therapy for stuttering, her work with the Stuttering Foundation, her work with the National Stuttering Association, travels around the world. She's just a walking masterclass. I don't know if there's a feminine form of the GOAT. That's an expression for the greatest of all time. So that's it. So we're in the presence of greatness. It's so good to see you. There's so many questions.
Uri. It's good to talk to you. Yeah, sort of. We're talking. Yeah, sort of in person. Yeah.
I think we're talking. I love your headset. I love your headset.
You'll have to thank my son for that.
Okay, good. We'll deal with that offline. It definitely sounds great. So tell us, besides that boring intro, what do you think are some things you would like people to know about you that don't show up on your bio that shows up everywhere?
I love contra dancing. It's one of the things that I really missed during pandemic. I'm a contra dancer and I travel around going to contra dance weekends. And that's something I really, really miss.
Wow.
The other thing that I think that many people listening might already know about me, but I'm the parent of a adult disabled young man and with autism and intellectual disability. And so most of my life is really surrounding being in the world of disability. We have a special needs family. And so that's what I'm really all about. Although it looks to people, it looks like I'm about avoidance reduction therapy, but I'm really about my family and making sure that my son is taken care of, and he lives at home with us. I do have another son who's fabulous. But right now, our younger son with autism is living with us. And so that's what we do. That's what we're about.
I didn't want to take the liberty to share that, but I do think that's something that is a big piece of what makes you so exceptional. Would you say that there's something about being a mom of a child with difference that contributes to the way you show up, obviously as a mom, but also to the work that you do? Do you feel that adds a dimension that is unique?
Well, I understand parents a little bit more than maybe I would have. I don't take anything for granted. I know how hard it is when you're trying to sometimes have careers, sometimes just manage. I think that many people know about the research in, a lot of high divorce rate among people with special needs in their family. There's stressors on the family. There's financial stresses on the family. There's emotional, social. And so there's a lot that goes into it. I'm not saying that parents of neurotypical kids are having it easy, because they're not, especially right now. But it's just another layer. It's a little different.
I think it's helpful to humanize people that we admire. And I think a lot of people admire you. And I think to know that you're a mom and a mom at that level, and that sometimes it's hard, just acknowledging that really normalizes it for the rest of us and for all the people. So certainly I can resonate with that. I always tell parents when we're in a session, don't mistaken me for I have all the answers. I am one fantastically imperfect parent. And if you want to hear it straight from an imperfect parent to another imperfect parent, then I'm happy to share. But
I used to always say to my older son, who we always say he's on the other end of the bell-shaped curve. I always say, you know what, save it for the couch. When you get older, go to the psychiatrist, save it for the couch. But look, in any particular moment, you problem solve, you do things that you think are the best. Would I go back and do things differently? Of course, wouldn't we all? But there's always tomorrow to do what you feel is right tomorrow. So, and the other thing I want to say about being a parent, it never ends. It doesn't ever end, That reminds me of times that I used to go to conferences and spend time with your dad. Yeah, and your dad used to invite me to his room in the hotel, and we'd have lunch together, and because he'd bring his food, and we'd have these wonderful talks, so we'd go on walks together. And guess what we talked about, Uri? Our kids.
Which he talked about my brother all the time, right? That's awesome. Yeah, I left that out. Another intro would be what I could say about what my dad wrote about Vivian, but we'd be here all day. The mutual respect, admiration, and affinity that Vivian and my father share goes both ways. It's very deep, it's very long lasting, and transcends everything, but very, very powerful. And it's very much a privilege to feel that I have my connection to you through that, but also on our own. And it's always a treat and a pleasure kind of bouncing ideas with you and being challenged by different things that you'll push me on. Those are some of the things I look forward to most and I miss most. So I'm glad we're talking. You gave me a tough job. When you posted it, you said there are lots of people that are trying to find time to talk to you, and they're going to have to suffice listening to me being like their agent. Chatterbox, but
that was sort of my excuse for not keeping up with my friends when I really want to. So, and missing everybody.
Totally.
Just think about, when we go to conferences, we go to professional events, that's our time to connect with our friends. I mean, our colleagues are our friends, especially in the stuttering community. And having the one-to-one time with people, and the hugging. I'm a big hugger.
That is what I miss most. You know, distance is one thing. You get within proximity, people. I haven't had like a good hug besides my. Thankfully, I have a wife. Thankfully, I have kids, and I don't say that lightly. But for people that don't, and that are really distanced, but for grandparents of grandchildren, and for so many people, yeah, to greet each other once a year with a hug, and you know, for me, due to religious reasons, it's a little bit easier because I don't try to have physical contact with people other than my wife. So it sometimes gets awkward when people want to have a really tight embrace, but I try to limit that a little bit. But for sure, like the embraces, that is very much missed. So let's be a conduit for that. And if you have comments or questions, I will try to monitor Facebook to the best of my ability. So Vivian can just be Vivian, flowing, doing her thing. I'm sure she's doing 1,000 screening us at the same time also, but I'll try to weave your stuff in. So if you drop a comment, a like, a share, you'll help this conversation reach more people. And without further ado, Vivian Sisskin. So, you know, here we are, it's COVID. What can you say about what's shifted in your practice in terms of how you're able to deliver care? Are you able to, people are always asking me, is Zoom, should we wait till this is over? You know, is Zoom really doable? How do you respond to that, and how's your practice kind of doing that, handling that?
Yeah, I mean, certainly things have changed, but we're having pretty good sessions on Zoom. We've adapted quite a bit. And I think that just to give you an example, we have several groups going, but my Saturday morning group, which is a staple, always had a Saturday morning group, and the composition has changed over the years. But my Saturday morning group has been more consistent than ever before, because you can get up and put your slippers on and maybe change your shirt and come to group. And they don't want to go back in person after this is over. I find that so interesting. They said, no, we're staying virtual because we don't want to lose anybody in the group. And we know that even though we lost some people when we went virtual, if we go back to being face-to-face, we'll lose some people too. People who can't drive the distances. Here we are in the Washington area. The traffic is rough. Getting from one place to another. I always live in places that are very, very difficult to get around in. I'm from Los Angeles, always had a traffic problem. Back to traffic problems here too. So we're making do.
Thank God. Thank God I live in New York City. So
yeah, I think that it's a little harder with the little ones. But the silver lining to that is that we're able to work with the families. The families are online 100%. And not that our family, we always worked with the families in the room, and that's our model. But they would rush in and say, you know, I'm just going to run over to the grocery store and get one thing and get right back, you know. Here, they're the whole time, and we have opportunities to really sit and talk with them if the kids, you know, get tired because they can't sit for that long in front of a screen. So yeah, there are some good things to say too.
Yeah, I think my big point whenever I talk to people is, if the need is there, don't put it off, because we're going to be living with COVID at least for the next couple of days, right? It's going to be just this much time, and then it's this much time, but it's here. And if you have a present need, I think good professionals that could help before, most of us have adapted. Certainly there are certain ages that are tougher, but with the little ones, something I would say that's become reinforced, similar to some of the things you said, is the parent involvement. And for parents to realize, look, you're already the teacher at home, the phys ed instructor, the counselor. So being a change agent for your child, really being a parent, but learning how you can be a part of this process and be a hero in your kid's journey is that much easier to put across, because you're clearly not going to be putting it on the therapist to do in 40 minutes with a magic wand. And the other good thing is getting videos from home. We've always done that, but more so now. So getting video clips, then you really see the child in their natural environment, as opposed to something more artificial in the office.
Yeah. And in another area of my life, which is teaching, which I do quite a bit of, when we were sort of thrown online last spring, the idea of doing it all online was, oh, how are we going to handle this? You know, how are we going to do? I redesigned all my courses to be online courses. And so I'm actually, I can't believe I'm actually saying this. I'm actually, I'm actually enjoying teaching my courses right now because I'm not struggling with throwing something that was meant to be face-to-face in an online format. So now it's organically meant to be that way with a variety of different activities. I've changed the assignments. I've changed the lecture format. And so that's worked out too, to my surprise.
Yeah. I was speaking with Rod Gable and talking about teaching. He's starting up the program at Binghamton University and then the work he does in Africa. And we were talking about how they would have these Zoom meetings before COVID, trying to empower people to be able to become helpers for other people who stutter. And he was talking about the effectiveness and what they did and how time consuming it was. And then he stumbled upon what I've been doing and what you're talking about is make the presentation material available offline or asynchronous. And then the meeting time can be much richer discussion around the content that's already been processed or digested or presented. And then you can really have much richer time. There's no need to get on Zoom to hear a presentation.
Yeah.
It's a good time for the interaction.
And also the ability to bring in guests. I
Right.
love that opportunity. You know, we did before too, but most of our guests came in person and sat in the classroom. Now we're able to bring in guests from all over the world, and it enriches the learning environment tremendously.
Yeah. Well, hopefully, in many ways, we'll hopefully be back to something that resembles life before much more than not. But there definitely are some things that we should hold dear, that we shouldn't go back to the way things were and just turn back the clock as if we're just going back to the way it was. There's a lot of things we've learned along the way, and there's also things we've come to appreciate and different strengths that we've uncovered, things we used to avoid, perhaps, responsibilities. So that's a nice segue. Yeah.
Yeah, I've stepped out of my comfort zone a bit. So I don't think I've ever really swam in my adult life, and I'm swimming every morning now, which is, my husband and I look at each other and say, is this real? Are you really doing this? And I'm talking to my friends and they go, okay, first of all, let me get beyond the idea that you're actually putting a swimsuit on, because I think 10 years ago, you might've said, I don't need to do this ever again. And here I am going in a pool every morning because my son lost his day program and his love is swimming. And so we managed to get to a socially distanced pool situation with lap lanes. And so I go swimming with him every morning. Actually, our whole family goes swimming every morning. And so that's really facing a fear. That's really stretching my comfort zone.
And I think also that says a lot for those people. When you talk to the people that are the greats, you talk to the Vivians and others, they tend to be people that push themselves too, right? They're not just preaching, they're also practicing, so as they're helping others get out of their comfort zone, they're also doing things to push themselves further. I love that. So avoidance reduction therapy, do you want to go there and talk about kind of like where did it all begin and your original learning with Joe Sheehan and the influence and kind of like the evolution of you from, I don't know, undergrad and like how you kind of actually chose to dive into stuttering and then the evolution of how you kind of came to treat it.
So I can talk a little bit about that. I was rather fortunate when I was an undergrad at UCLA, and I was mentored by two very well-known people in the psychology department. One was Joe Sheehan, and he was, of course, in the psychology department. There was no speech program, no communication disorders program at UCLA, but he was in the psychology program, and he did teach a course called Psychology of Speech Disorders, or something that he called it that fit into the department. And the other person who influenced me quite a bit was Ivar Lovas, who was also in the psychology department. If those of you who don't know who that is, because as I'm getting older, I'm finding people don't know who that is. He's the father of ABA therapy for autism. And I did work with him at Camarillo State Hospital at the time. That hospital no longer exists, with young children with autism. And at the same time, got involved in the UCLA speech psychology clinic. So I was heavily involved in both the behavioral movement and also for autism, but also being absolutely fascinated with stuttering at the same time, and becoming involved in that clinic. And I had a little bit of a schizophrenic experience at that time, because Ivar Lovas always thought he liked to put exam questions that were about stuttering on his exams. I think it was to poke at Joe Sheehan. And so you always had to answer them in a behavioral way, an operant way. And then Joe Sheehan would say, doesn't follow the law of effect. So I was like this undergraduate going, what do I do? And so that was sort of an experience that I had as an undergraduate. I knew that I wanted, at that time, I was thinking of actually going and living in France. And so I got a teaching credential to go live in France and teach English in France. But I ended up making a decision back and forth between going into psychology. Joe wanted me to go into the psychology department to get my PhD in psychology at UCLA. And his wife, Vivian Sheehan, said, no, you'll be a great speech pathologist. And the two of them would fight over that. I don't know if people knew that. They would argue over what I should be doing. And Vivian went out. I really wanted to do clinical work in speech language pathology. And I worked with him there, met my husband there. My husband of 40, how many years is it now? 43 years.
Sounds like you got married when you were 15.
A little younger. You're making me a little older than I am, Uri, you know. So, and until his death in 1983, I worked with him there along with Vivian, and I remained friends, in close contact with Vivian until she died in her 90s. And I'm still friendly with one of their daughters. So still have a big Sheehan connection.
It's like the Schneider connection, transgenerational.
Yeah.
That's amazing. What would you say is something people don't appreciate or don't know about Joe Sheehan? And I think one of the things that's interesting for people like yourself that were really prodigies of the greats, they evolved over time, didn't they? Right? Like people sometimes encapsulate people at one point in time with one thing they said, and at another point in their career, earlier or later, they may have said something very different. So is there something you feel is underappreciated, something that you could just highlight that people don't get just right about Joe Sheehan?
You know, I don't know if it's underappreciated. Well, I think people don't know how funny he was. I mean, that's what I'm going to start out with. He was hysterical. And he told jokes at every single staff meeting. We'd have a staff meeting before clinic began at the, you know, on Wednesday night clinic. And he would tell jokes. He would also tell stuttering jokes. He would tell all kinds of jokes. He was very, very funny. And that's one of the things that I remember. He also was rather hard. I mean, he was hard on me. The expectations he had, he would throw things sort of on my desk as a TA right before the weekend and expect them to be done by the end of the weekend. So, you know, he had what he called high demand, high support. And I resonate with that. You know, you think about demand being high or low and support being high or low. The best combination could be high demand, high support. The worst would be low demand, low support. That's or right. High demand, low support would be the absolute worst, because you have high expectations but give no support. But right. He had very high expectations, but he was also very supportive. I think that in terms of his work, he didn't write enough. I take after him in that way.
I was going to say, if you're reflecting on that, I'm wondering how you've incorporated that, but you're following in that path.
Yeah, he didn't write enough. It's a long line of great people who don't write enough. Dean Williams, Joe Sheehan, just didn't write enough. And so a lot of what I remember about his understanding of stuttering, his living of stuttering, is what he talked about, what he told me. And so sometimes I'll have a quote and people say, well, where is that from? Can you point me to the reference? And I go, no, he just said that. He said that all the time. So there's a lot of just verbal, folklore of things that, You know, even today, when I talk to his daughter, Marion, we laugh about things he used to say all the time because it was just, you know, they weren't written down. The other thing, I think people think that his therapy and his ideas about stuttering were that stuttering was a learned behavior. And he said very clearly, even then, even back when he was writing about this in the 60s, and certainly when I was with him in the 70s, he said that stuttering, there's a genetic predisposition to stuttering, and that what we're seeing in stuttering is, you know, reactivity is learned. And a lot of people think he saw it as the nature of stuttering is learned as an approach avoidance conflict. And he never said stuttering was caused by an approach avoidance conflict. He always used the approach avoidance conflict to describe what happens in the moment of stuttering. And that's something that people don't understand.
I want to dig in on that just for a moment, because I think it's a really subtle, significant point. I listened, as I said, I love Peter and I love Stutter Talk, and you can listen to Vivian there and so many other 600, I don't know if they're up to 700 amazing podcasts at stuttertalk.com. But I'm very honestly, I loved listening, and I always enjoy listening. You have a very matter-of-fact way of saying it, but you explain things very well, and you make certain distinctions that I think pierce through some of the fog that people have. So can you you were saying Joseph Sheehan is thought of as someone who talked a lot about, you know, and you talk about choice and the idea of the behavioral side or the learned behavior side. And then you're trying to also distinguish, there's a part of stuttering that's an experience that's, you know, biophysical and neurophysiological in its nature. And then there's a part that's a learned behavior. I think it would be helpful to some people, even those of us that have heard you talk about it, just to hear how you could kind of tease that apart, those two pieces.
Yeah, and I think that I'll talk about the way I can conceptualize it right now. That really is not exactly the way Joe Sheehan does, but I'll talk about the way I conceptualize it.
I wish I had Joe here, but for now we have you, so we'll take Vivian Sisskin's take.
So for me, I think that there are breaks in influency. Whether those breaks in fluency are in themselves neurological, or they come from the loss of control, or what, there are breaks in fluency that occur, bumps along the way in the way we talk, that are part of a continuum of fluent speech and disfluent speech in the normal population, with stuttering probably being on the more frequent side.
Almost like a spectrum. Spectrum.
Yeah.
There's a normal range. Within the normal range bell curve, you'd have people displaying some kinds of disfluencies. And then there's somewhere along that range where it's more than the typical.
Yeah. But I don't want to confuse the idea that stuttering grows out of normal disfluency. Stuttering is a thing. It is a thing in itself, and it does not grow out of normal disfluency. But when you have someone who stutters, who begins to develop what we call tension responses early on, reactivity to the moment of stuttering, that's when the stuttering struggle begins. And I differentiate struggle from disfluency, and that's the hallmark of the arts program, is differentiating struggle from disfluency. Disfluency is the part that maybe neurological, you know, the reactivity to loss of control, whatever that is at that moment, that doesn't have to be struggled. And when people are talking about wanting to either reduce their stuttering, change their stuttering, manage their stuttering, we can talk about all different ways of.
We're going to get there with the language. I'm interested in that. Yeah.
They're really mostly talking about their struggle, not the fact that there are breaks in their fluency, in the forward flow of speech, because most people who live very, very well with a lot of disfluency in their life, it's because the reactivity in the struggle is not there. And when I talk about struggle, I don't only mean physical struggle, but I'm also talking about emotional and cognitive struggle that goes along with that frustration of having the break in disfluency.
Let me tell you a quick story that happened a half hour ago, and tell me if this is a good illustration for people to just bring it into. There's a boy I actually mentioned last week with Gareth. He's a lacrosse player. He's a high school kid. And we just started working together on Zoom. And this week we had a meeting today, and he says to me, yeah, this week I participated on a skit in school. It was on Zoom and we all had to read our parts, and it went really well. And I said, that's awesome. I said, how'd it feel? He's like a 7 out of 10. I said, that's great. That's great. He's like, yeah, there was some stuttering there. I said, but what did it feel like? He said, it felt really good to participate and to do it and not worry about it. I said, that's awesome. What would it have been like, like 2 months ago? He says, oh, it would have been like a 4. Like I would have been fretting and anticipating and kind of like having all this kind of managing effort going on. And his mom reported that she was listening to him do this on Zoom from the kitchen. And I said to her, how was it for you? She said, it's hard to describe. It was both calm and exciting. I said, oh, can you tell me more about that? She said, it was just so nice to hear him participating fully and freely, and then to see afterwards on his face the shine of delight. There wasn't like a feeling of like he slipped by, he survived. It was a shine of delight and flow. Does that capture kind of what you're talking about?
Yeah, I think that the only part
or how
of,
would you look at that? Or how would you bring your,
yeah.
what you were talking about, that prism, I was wondering if that example could kind of be unpacked
Yeah,
by
I
you.
mean, I think that when you talk about the 7 out of 10, rating that and good day, bad day, my hope is that eventually they move beyond having to rate their communication in terms of their stuttering, that their stuttering is not something that is going to.
Oh, we'll get to that, because actually he
color
wasn't
their
rating his
day.
stuttering. He was rating his ease in the moment.
Yeah.
His flow in the moment had nothing, not unrelated to the speech. We disconnected it from the speech, but we can, so the idea of rating the speech is something that we try to move past.
Or eventually what we want to happen, to me, the outcome would be that it's not a thing. There's no life impact. Sort of my husband's stuttering is sort of like that. There's no life impact to the point where he's not rating his ability to be spontaneous anymore. He's not rating his enjoyment. There is enjoyment. There is joy of communication. There's spontaneity. There's confidence. And it no longer becomes something that has to be looked at separately from any other identity he has. Of course, you're going to look at other identities when they're appropriate. I'm going to look at my identity as mother, as a Jewish woman. I'm going to look at my identity as, a sister. You look at your identities all the time, but if one is on your mind and always has to be evaluated, then there's still some life impact there that you might want to move past.
Amazing. So that speaks to, and there's some comments here, a lot of friends, and I'll mention some of them in a bit, but the question about the social model versus the medical model.
Yeah.
Do you want to just reflect on that a little bit, wherever you want to go with that, and how you incorporate that, and what are some of the things that you also want to point out as places where things could go in a direction that actually complicate or inhibit the ability to move things forward, but the importance of incorporating that in certain ways for sure as we go ahead.
Yeah. So my evolution is still going in this area from the medical model to the social model. And I have to thank a couple of people that have really helped me in this way. And I've put a shout out to the authors of Stammering Pride and Prejudice, Patrick Campbell and Sam Simpson and Chris Constantino. And also a lot of my colleagues and friends in the disability movement in the area of autism. Kristen Gillespie Lynch, Joshua St. Pierre. There are some people who I've had some wonderful conversations with and helped me realize that I've always been in the social model, but never used the terminology because we use terminology that we're used to using. And if we grow up in the medical model, so if those people listening don't know what I'm talking about, the medical model basically is where you see stuttering as a problem of the individual. It has to be fixed or changed. It's the responsibility of the individual to get therapy or rehabilitation. In the social model, we look more to society and stigma, discrimination, barriers, challenges that often lead to limitations for the person who stutters. I'm gonna go back to my evolution, my thinking about this, because I've been thinking about it a lot lately. The autism movement is way ahead of us on this, and we're kind of shadowing that. In fact, the area of stuttering has always shadowed the field of psychology a bit. When they were doing Freudian psychology, we were doing analysis for stuttering. When the behavior movement was big for psychology, we were doing behavioral therapy. So we've kind of mirrored this psychology movement. When it comes to the autism movement, yeah, a couple of decades ago, we were searching for the cure. That little puzzle piece that everybody was wearing, that little ribbon, which I refused to put on my car or wear because I wasn't trying to unlock the cure. Even when my son was very, very tiny, I diagnosed him because I was, a speech pathologist who did a lot of pre-verbal assessments in those days. And I was never looking to search for the cure. But the autism movement has had a great grassroots movement to move away from finding the cure, making it, fixing the person who is autistic, and instead looking at it in the area of neurodiversity. And it's heartwarming relief. It's freeing to me to see the stuttering movement move in that direction. We're behind the autism community in doing that, but there are some really great leaders, young SLPs who stutter, people who stutter who have joined in and partnered with speech language pathologists to change the way that we think about stuttering and our outcomes for therapy. And I think it all comes down to outcomes for therapy.
So, what can you say about that? I was actually leading a lot of conversations on this very topic, and it was surprising just raising that topic, meaning talking about outcomes and how the outcomes and goals we set, so let's say the goal was to cure the stutter, and the person at the end of therapy, or at the time they decide to stop, or we decide to stop it, if that's the way that model is working, they're still stuttering. So then someone failed and someone didn't do their job, and the responsibility to fix it is still kind of dangling out there. And I was talking about that as like collateral damage. We talk in medicine about side effects. We talk about quality of life. If you have, God forbid, a loved one dealing with cancer and you have the best cancer hospital in the world, you don't necessarily want them to go in with the heaviest dosages of chemo and radiation to zap the cancer, because there are other impacts to that. And I think in speech therapy, we don't think about the other side. In other words, if speech therapy is a powerful tool for the positive, powerful contribution, it must also have certain risks. And I think as practitioners, we need to think about that. So when I opened the conversation about that, it was amazing how certain people push back so hard. How could you be so critical? And so I just wanted to hear what your thoughts are on that outcome, how it all comes down to that.
When you talk about pushback, I think it's interesting, because it depends on how you ask the question. So if you ask a new client, what they want out of therapy, yeah, very often they'll say they want to be fluent. It can, that's what they understand, but what does that mean to them? So you have to ask the second question. And when you're fluent, what will be different? Or what would that mean to you? Or what will you be doing that you're not doing now? And it always comes down to, I want to feel confident. I want to feel spontaneous. I want to participate. I want to not think about my speech. I don't want to be exhausted every time I talk. And so when you think about all of those outcomes, from my perspective, those are outcomes that are really possible. Those are all about struggle. And those are all about ways that you can change. And I'm one of those people who thinks that change and acceptance are compatible. And so I'm very much in favor of self-acceptance as a person who stutters, but it's acceptance of identity and role. And that's what, believe it or not, arts is all about. Arts is about identity and role, more than it is about how you stutter or even avoidance itself. It's about role. And I think you asked me a few minutes ago what people didn't know about Joe Sheehan is that they see it as, yeah, avoidance reduction therapy is reducing avoidance and removing escape behaviors, Van Riper strategies and voluntary stuttering. No, that's not what arts is about. It's about changing your relationship to your stuttering and becoming role congruent, so that when you go out in the world as a person who stutters and you do stutter, you're role congruent. It's when you go out in the world as a person who's hiding or suppressing or managing or minimizing stuttering and you do stutter, that's when you have the role conflict.
What's the quote? What's the quote about suppression is the condition?
Oh yeah. Successful suppression of stuttering is what maintains and perpetuates it.
Just say it again so people can just chew on it. It's a mouthful.
Successful suppression of stuttering, so hiding it well, is what maintains and perpetuates it.
And could you unpack that back into the frame you shared about what's the physical component and then what's the reactive component and how that ties in?
Yeah. So if you think about when people start in process of therapy of analyzing their stuttering pattern, because many people have a kind of therapy where you start looking at your stuttering pattern, start observing yourself and seeing what you do. The first thing people would look at is how efficient they are. Okay. Now, if you have little bumps in your speech and every once in a while you have a disfluency like I'm having right now, I'm not interfering with my efficiency at all. Okay. So I'm fairly efficient. Nothing is really getting me to, get off track. However, when you start using escape behaviors, you start adding in words, you start starting over, you start putting in interjections, you pause, you beat around the bush, you substitute words. All of the things that we consider escape behaviors and avoidance behaviors, escaping and avoiding the moment of stuttering, those are the things that lead to the inefficiency. Okay, so for me, all the inefficiency is reactive. And one of the outcomes of arts is efficiency of communication. So that's one thing I think you can change is efficiency in the speech direction. I'll go through, since I'm on it, I'll talk about the outcomes of arts because people maybe want to know that and why it fits into the social model.
And I just want to highlight, first of all, I resonate personally, and our approach is so resonant. Certainly we have different, vernacular, and we do things slightly differently, but everything Vivian's saying, I just want to say on a personal, professional level, listen carefully. I think, you're listening to the GOAT. And again, her ability to articulate this and pull it apart is incredible. I also just dropped a comment. Keep your questions coming. I'm going to find a way to weave them in. There's a bunch of people here, maybe just for the moment, just to acknowledge a couple people who I know you'd be happy to hear. This is really not about me, and it's not about Vivian even. It's about connecting people and keeping our conversations going. Gareth Walcom, Trisha, Lynn Remsen, and Amy Dixon-Heron, Tom Sharstein, Hope Gerlach, hey Hope, Matt Phillips, Adam, Mark Winsky, Anita, Jen Giacomo. She's looking forward to having a Guinness with you. She says it changed her life. There's so many wonderful people here. So keep your comments coming. Also regards from Chile and other parts of the world. Mm-hmm. Yeah, tons of great people. So keep your comments and questions. But yeah, great opportunity to hear it straight from the source in terms of the outcomes and what we can learn more to understand arts better, as we learned about Joe Sheehan, certain things that are misunderstood or underappreciated. What those things about arts?
So efficiency, I think, is an important one because I feel that the frustration that comes from stuttering comes from inefficiency. Also, a lot of the stigma comes from observing people being inefficient and uncomfortable with their stuttering pattern and not understanding it. And then as we talk about, the internalization of that self-stigma is one of the things that we deal a lot with in therapy. But the second outcome is comfort in the stuttering pattern. And so what we're trying to do at that point is take away the things that are making it hard to communicate. It's not only effort from pushing through a sound or physical effort from stuttering, but it's the effort in energy in your head, mostly in your head, worrying about what people are thinking, worry about what you're thinking about what people are thinking, and emotionally, the effort that it feels to endure, shame and embarrassment and feeling less. And there's a lot of discomfort in the moment of stuttering that's not only from the stuttering pattern, it's from feeling different and feeling awkward. And so we definitely want to work on improving, reducing discomfort and making the stuttering can be much more comfortable. And I think that when people come for therapy, it's not that they don't want to stutter, they don't want to feel uncomfortable. That's one of the things that they want to feel. The other big one is confidence, and that's our third outcome. So confidence in communication really comes from feeling that you're a good communicator, feeling that when you are actually communicating with others, you're a leader and you're a follower, you're connecting, you have this confidence that you can communicate well. And so that's another one. And then the fourth one, which I think is the most important one for arts, is spontaneity. And so that's where we are. And this is the big difference, is we're anti-strategies, anti-technique, we're anti-management. We don't manage stuttering. We don't manage, and it's not something to be
We don't manage it, we control it.
Oh, we don't control it. We don't suppress it. We don't minimize it. We don't have techniques, because I feel that when you're doing all of those things, you have to be doing something. And when you're doing something, you're telling yourself that this is not good enough. I have to change it. And the idea is, when you stop fighting stuttering, when you stop fighting the actual disfluency, all of that settles down. A lot of the struggle comes from trying so hard to be fluent.
I met a guy yesterday for the first time. I just want to, what you just said speaks to me. Just a quick analogy. Met a guy, his story, he was so full of story, and he was so full of thoughts about what other people are thinking, about what he's thinking, about what they're thinking. If only we were so good about thinking about what other people are thinking about what we're thinking about what they're thinking, then it would be efficient. But it's a big waste, because we're not very good at reading people's minds if you're the average human being. I was thinking about it like a competitive cyclist. You try to minimize drag, and then you work on your technique or your performance, and you get it to be very efficient. But it's not only by training to pedal harder, it's by minimizing the drag. And so, like, over time, most of us, and I think this speaks in my language to the layers of psychological, behavioral reactivity and coping mechanisms, we pick up a lot of drag, we pick up a lot of weight. And part of the process of therapy can be most efficiently done to work on that efficiency by dropping the drag. It's not necessarily learning something new, but letting go of some of the mental load and the emotional load and the physical load that you might be trying to manage, which is draining, a certain amount of mental effort, physical effort, and it just creates drag. So when you drop that, it sounds dramatic what Vivian's saying, but the way I'm thinking about it is like you try to optimize efficiency by dropping the drag. I think it's an interesting analogy.
Yeah. And I love analogies. I use them a lot in therapy too. So that's, and I love when my clients come up with analogies as well.
What would you say about the analogy? I'm picking, you didn't resonate fully with it. I'd love to hear you take your take on it.
I know I'm just going my husband is a cyclist, and so I was going in too deep in my head. Don't worry about it.
Or in swimming, it's similar in swimming.
Yeah.
I was gonna do swimming, but I'm too hairy, so it's slowing me down. A little too much drag. So I was gonna get a full one piece, but then my wife said everyone's gonna laugh at me. So I just said, you know what? I'll just go running, and I can keep my clothes on for the most part till I get into the trails.
Yeah. I mean, I think that we could stop trying to think about what other people are thinking. But I think the way I look at it in the context of the therapy I do is, go ahead. Go ahead and think whatever you think, and give them permission to think what they think. And it's about giving permission that it ends up being less of a life impact for you. If you anything you say you don't want to do, don't do that. No, feel the shame. Allow other people to think you're stupid. Allow other people to think anything they're thinking. They have a right to think that. And if we predict that someone is thinking that we're incompetent because we stutter, they have a right to think that. And it's giving them permission to do that and giving yourself permission to stutter, which I think is the way we go in arts. It's all about that permission, letting it be.
I think that right there, if anyone's looking for it, giving yourself permission. We had a team meeting in November 2019 before this whole thing happened. And Julie Jackson said that line about, or was it Julie said something else, excuse me. She was talking about agency. And Tiffany Marino on our team shared this idea of giving ourselves permission, giving parents permission, giving our clients permission, whomever they are. Just that concept, if you just sit on that for a moment, that right there has taken our team through this entire year. That's been the theme of what we've done to kind of take our work to the next level. I think giving people permission just opens everything up. And then going, otherwise you're suppressing, right? Otherwise you're pushing down, you're pushing back against something. That's powerful.
I was meeting with a group of my grad students, clinic students, and there's a whole big group of them. And they were stressed, of course, grad students are always stressed about their clinical work. And at one point I said to one of them, I said to the whole group, I said, you have permission to be graduate students. You're not going to know what to do in your sessions. And one of them said to me, no one's ever said that. It's almost like you have permission to stutter. No one's ever said that to me. He looked at me and he said, no one in the program has ever said, we have permission to be grad students. Wow, that really changes things. So I think it goes across a lot of areas.
And I'm hearing it in the way that Joseph Sheehan was training you with the high demands. On the one hand, it's tough, but it also says he believes that you could do it. And I think when we believe in our clients, when we believe in parents, when we believe in ourselves, that's a very important thing. People rise to the occasion. And then providing the support to really says, I know that it might be more than you can handle. That's why I'm here. And that's where we can position ourselves to be there as needed. And that allows people to get bigger, play bigger, live more, go for things out their comfort zone. There's a bunch of questions. When you're ready, I wanted to just
go back to the social model for 1 minute, because I know we had a question on the Facebook page about where I think the field is going with the social model and stuttering. So we have 500 plus programs in the United States in training speech language pathologists. We have many, many training programs at the MA level. And I would say, and you probably would agree with me, when you meet someone, we have, we know who the specialists are in stuttering and people who resonate with working with people who stutter, whether they're specialists or not. They had a mentor who taught them about stuttering, who got them interested in stuttering. We all can go to that mentor. And the problem is that most people, these mentors are someone they met in their graduate program or shortly thereafter. Most of the people teaching stuttering courses in these graduate programs are not people who love stuttering, who understand it. And so they're teaching it as if it's a disorder to remediate. And so all those graduate students are graduating out of those programs with this idea that you need to fix stuttering. And it's hard to change that once they go into the field that way. So I think that my feeling is that we need to go in that direction. We need to look at the training programs and help people and teach stuttering within the social model of disability, not just go for the clinicians and having them treat that way. I think that has to be more basic in terms of learning about stuttering within the culture model when it's taught to the graduate students.
What would be one small step in that direction? So you have many grad schools where the instructor is not a specialist. They're teaching it as one of many courses they teach. Sometimes it's a short seminar, half a semester even. What would be one thing you'd like to see baked into that experience that might make that shift in terms of how that clinician comes out thinking about stuttering?
It's very clear. They have to be a member of the stuttering community. There has to be participatory research. There has to be involvement with people who stutter. They have to understand the experience of stuttering. And many of them who are teaching the course maybe have never met someone who stutters who wasn't their client. That's big.
What are your thoughts in terms of, and we had this conversation publicly and privately last year in Fort Lauderdale, where you really hosted and brought this to the forefront for the entire, research symposium before the NSA conference. Do you see kind of throwing the medical model out with yesterday's garbage, throwing the baby out with the bathwater when there's no baby there, and just totally leaning all the way in to the social model? Because there are those, and there were those there that raised that voice, which would say that any form of treatment or a parent choosing to treat a child who stutters is making a decision that is unjust and is not with the permission of the child. There are those voices. And I'm curious, that's taking this, maybe the social model and then some. And then on the other hand, there's a way to incorporate those values in a nuanced way. I think there's no one better to address that than you. What would you say?
So I think the way we have to look at it is, when you said treat stuttering, it's very clear when I teach my autism course that I say right from the beginning, we're not treating autism here. We're learning how to treat people with autism who have communication needs, speech, language, voice, whatever it might be, fluency. In the same way, I don't think we're treating stuttering. We're treating reactivity and life impact that is making it hard for that individual to live a fulfilling, happy, connected life where there's joy of communication and connection and communication. So yes, there's a combination of things. Yeah, are we treating certain things? Sure, we're treating certain things, but we're not treating stuttering in its basic form.
I would say we're not even treating the thing we're treating. We're helping people. Like you said, we're helping people communicate and enjoy communicating. That was something that came out, not surprisingly, from Ruben Schuff. The conversation with Ruben, always so insightful. And obviously you've had a big part in his journey. He in his own right is extraordinary, but he quoted you many times. What would you say? I've got this cough. If you notice, I keep muting myself. I find that my work with people who stutter is helping me deal with this cough. It's helped me deal with different challenges through COVID. It's being a father of kids with different needs and different strengths has informed my work in helping people, and the work I do with people has been so informative for me as a father. I'm thinking about my cough. It's a physical thing. Now, I could have canceled our conversation, and frankly, the past week, 2 weeks, 3 weeks, I said I'll just wipe everything clear and wait till it goes away. That would be one option. I'm seeing a pulmonologist to check it out, but it's been an allergic type thing, and it's hanging out with me. So it's a physical thing. So I feel in some ways there's a certain similarity to the physical experience of stuttering, and there's the behaviors around it. Like I keep muting myself. That's a way that I'm thinking about how to manage this conversation, how to choose to have this conversation, but at the same time have the least distractibility for me, for you, and not blow anyone else's ears off. On the other hand, maybe why am I even muting myself? So I'm just thinking about stuttering where you don't have the option to mute those moments, let's say. From an arts point of view, from your point of view, could you kind of bring the arts model to my cough? What would be some things you would be thinking about? Not to give me therapy, but to kind of bring it into a realm that people that don't stutter maybe could even get it a little bit.
Yeah, I mean, the first thing I would say is what you're doing is to look at it and try to figure out if that cough is something that's interfering with something. If it's interfering with your comfort in communication, yeah, do something about it. So my feeling is that when I see, and this is what it's going to go, this is a little bit of more controversy. When I see people
Bring it on.
who have choices to make their stuttering pattern more comfortable, more efficient, so that they have less frustration, they have less exhaustion. This is about comfort, and they're more willing to connect with people. I can't see the downside of that. So being against therapy for the sake of being against therapy for some theoretical reason, it makes no sense to me. I think in
That way,
terms
that's
of,
the controversial part, or that's where you're saying
well,
where
no,
you
well, you
don't
were
go to the
mentioning
end.
some people who
Yeah,
say no therapy at all. In
right,
other words, if you're
right.
very much into the social model, it's really, but you know, there's also this idea that, and I asked this question to Joshua St. Pierre when we were online for something else. I said, what is the individual's responsibility and what is society's responsibility? So there's responsibilities from both sides. So society has to become more knowledgeable, more accepting, and live with people who are diverse, even, you know, minor neurodiversities, you know, these different communities. On the other hand, the individual can also change to make that connection more comfortable and easier as well. And so I think there's a connection, there's something on both sides. In terms of your cough, yeah, certainly reactivity, you know,
I'll
worrying
just show you
about,
what I'm doing. I'm just gonna show you behind the scenes to be totally transparent. I've got this 20-ounce tumbler. I've got two ginger lemon teas going in there with fresh raw honey. Then I've got a Ricola I just popped in. I've also got this clear fluid hydration, and I have an inhaler, a Seretide disc, and I also did a what's it called? The mist, right? The mist with the Butacort and the Ventolin. And I'm doing all those things, and I'm taking a very aggressive antihistamine. And yet I'm getting pain in my chest, and it's exhausting, and it
yeah,
bothers me. It
yeah,
interrupts me in the middle of sentences. I'm giving workshops where I have to do this for 2 hours, and I have to keep muting myself. And I have meetings all day, and I'm minimizing and making some adaptations. It generally hasn't bothered me, but it's starting to bother me. But I think I'm just illustrating, to me,
yeah,
it's a good thing where what you're saying, and I think it's nuanced, and I think, don't you feel it's easier to take like a absolute position? And what you're describing, I so identify with. I think for the earlier stage clinician is a more nuanced, tricky position, right? That acceptance and change are not mutually exclusive. That's what you said earlier. I
mhm.
think that's a very subtle rope to walk for the earlier stage
There are,
clinician.
there
Do you
are
feel that
lots
way,
of,
or?
yeah, there are lots of very subtle things. You know, I think the biggest contradiction that I see in clinicians, not necessarily early clinicians or young clinicians, is the contradiction between it's okay to stutter and here, use this management tool. So it's okay, but manage it. And I think that's a big double message from my perspective. From the double message perspective, from your reactivity and your cough, if
Yeah.
you're doing something different right now because you're talking to me than you would do alone if you weren't on Zoom. See, so you're not doing anything because of somebody's listener reaction. You're taking care of yourself in both contexts.
So therefore, the way that I'm caring for myself and adapting is not some kind of uh, extra load. It's a reasonable, healthy thing. Is that what you're? I'm just trying to
It's
tease out.
congruent. It's
It's
congruent.
congruent. Whereas if I was putting on a different identity or a different behavior to suppress the cough differently with you than I would once we close the screen, that would be different.
Yeah, yeah. And there is a nervous cough condition that comes from suppression
I
of the
was very
cough.
nervous today. I was
Yeah,
very nervous. You make
yeah.
me very nervous. I get nervous every time I come on, and then to speak with you and to know everybody's listening, and I got so many questions. I was a wreck.
Yeah. So I'm not nervous.
I'm not nervous. I'm not
That's
nervous.
what happens when you get old. You don't care anymore. Oh, it's funny.
Well, then I'm getting old, that and losing my hair. But yeah, I could get 10 years on me or something like that. Let's see. Do you have another moment? Can we throw in? I'll try to give you like a
Yeah,
couple quick.
get some other questions going.
Yeah, because there's a lot of people here. A lot of comments. Keep them coming. Vivian's going to get through all of them. If not now, she'll try later or whatever. Let's see. Yeah, we talked about the changing of education. That's a really good one. Oh, this is a good one, Vivian. I want to hear your take on this. Anita from Sweden. How can the international SLP help the stuttering community to get the frauds, those people who leave behind a trail of devastated people with debt, and a lot of hurt. So like you said, those promises of outcomes and unmet expectations are not only unhelpful, but they leave people not only poorer, but really often shattered. Their hopes were shattered, and every time your hopes are shattered like that, you're elevated, you're blown up, and then it doesn't manifest. It just collapses, and sometimes people don't get up from that, and sometimes they do, but it's very hurtful. So there's a lot of charlatans out there. What the question was, what could the
Yeah.
SLP community do about that?
I think, this is even more serious in the autism community, because you'll do anything that a professional
Very vulnerable, very
recommends
vulnerable,
to,
exactly.
yeah, very, very susceptible to quack cures and things to try. And I'll be honest that I've done some things, gone through some programs just to do it so that professionals
As
will
an
not say,
individual. Oh, meaning in the
as a
speech community?
parent, as a parent.
As a parent in the autism community, meaning as a,
I've done some therapies, and it was sort of, when I said it, when I met with the clinician, I said, I know this is going to do anything, but I don't mind spending blank $1,000 just to check it off and say, did it. And it was sort of a joke between me and the practitioner.
was your husband aware that you were just blowing that money?
What?
Was your husband in on this? What was the purpose of that? You were doing it?
I did not want to look back and say, gee, I wish I did that.
So you're saying even Vivian Sisskin, I'm saying as a sophisticated professional, there was a feeling as a parent, I don't want to leave any stone unturned. And even if my rational voice says this is not the direction to go, how could I not try it? Like, I've got to try everything, right? And I think,
or I had to experience what that does. In other words, if somebody, let me defend the other side of it. First of all, to Anita, I think that education about what we can change, education is the most important thing. And stopping people from doing things that are not helpful is going to be a problem in all areas. I mean, it's not just in stuttering, it's across the board. But I lost where I was going with that. What was I saying, Uri? I said
saying about that you did something just to kind of check it
yeah,
off.
Yeah.
And that
Yeah. So I think that sometimes something sometimes works for some people. We know this. Even in the stuttering world, I'm not going to say that, strict fluency shaping is not going to be helpful for some people. It is. And you can bring these people together and they can talk about how helpful it was for them. We can't ignore that. So because we're individuals and everybody's different, if one person is helped by, take a look at facilitated communication or, spell to talk, those kinds of things. It helps some people. Will it help everybody? No. So as a parent, you might think, well, my child might be the one that could be helped by this. And why should I?
Are you incorporating and including? Because I think there are people that are professionals with different approaches. There are people that are pseudo professionals from related professions that are pitching something that at least has some professional veneer and sense to it. And then there are people that are saying, hey, I cured myself. Or, hey, it was revealed to me, send me $10,000 to an offshore account and no guarantee, meaning I guarantee it until you pay me and it doesn't work after 2 days and then you can't get your money back. I think though, and more subtle than that would be, and I'll highlight something that I'm concerned about, curious what you would say, within the community, within the stuttering community, people who find success and really fulfillment and find the freedom and the efficiency that they're looking for in their life, and then they turn it into a for-profit coaching practice and start selling their experience to others. I'm all for self-help and I'm all for coaching and mentoring and helping each other. But what are your thoughts on that, and how should that be held accountable, and maybe who can do more about that?
Yeah, luckily in the United States, we have licensing laws, so we're happy. And I understand that she's talking about an international perspective, and I know many of the cases that she's talking about, those are true. But what do we do about the person who says, I made myself a millionaire through this strategy, and come take my workshop and you will become a millionaire too? Or what about, I lost weight this way, give me your money and you'll lose weight this way too? there's a lot of that going on in every realm of,
So the
health
burden is
or
on the consumer. The burden is on the
yeah.
consumer. The
Well, I think
consumer,
it's
is
not
that what you're saying?
completely on the consumer. I think that we need maybe to have written materials out saying which of these have some kind of, expert behind them. I think that in I don't know how other countries necessarily work it, but they need to fight for licensing laws.
But Vivian, even in the States, there are people that are working within the 50 states doing this kind of stuff. There's no
Yeah,
enforcement.
they need to be they need to be taken up on charges of practicing without a license.
Is ASHA doing that, or that's something an individual will bring up with the state
This is the
licensing?
state. This is the state. If
Mhm.
someone's practicing without a license, the state does that. What if a medical doctor did that? Wouldn't the state do something? What if I
Do
opened
you
up
know
my surgery practice tomorrow?
if you or I were to just call one of these state licensing agencies, and there's a person practicing and selling a cure, and they're operating out of whatever state, I won't even say a name to suggest anything, and we called, have you seen any precedent where there was something that was actually enforced and
I
one of these
haven't,
people was
I
stopped?
don't know enough about that. I'll be honest. I don't know enough about it,
Yeah,
but it would be the state complaint. Yes, they do take complaints.
for sure.
And there would be probably, depending upon the state, I don't know, there would probably be some kind of investigation.
So I
Um,
guess what one could do if one had that concern is they could take it upon themselves, if they feel there's a valid complaint, to bring it up to the state licensing committee and play that course of action.
yeah, there is something we can do in the States, but internationally, I just don't know enough
Yeah,
about it.
yeah, that's definitely true. Okay, we'll take one more question. Let me see. I think Mark. Yeah, so someone here asking, I think it's important to also take these like very concrete and direct. A lot of people are familiar with the term secondary behaviors. And so someone's asking, what's your approach with secondary behaviors? And I kind of can imagine where you're going to go with it, but I think for someone asking it, they deserve to hear it straight from Vivian.
Yeah, yeah.
Secondary
So
behaviors
secondary
like,
behavior.
yeah. Mhm.
Yeah. Secondary behaviors are of multiple kinds. There are physical concomitant behaviors, where you would do something with your hand or your face or lose eye contact during the moment of disfluency or approaching the moment of disfluency. There's linguistic ones, word substitution, restarting phrases, restarting words. There are role escape behaviors, pretending to be fluent, pretending to be confident, pretending to be a clown, pretending to have a foreign accent. These are distractions and escape behaviors that allow you to escape the moment of stuttering, and they work. They work initially, and because they work initially, they are they become habitual. So what happens is that they allow you to escape the moment of stuttering. You go, wow, like my name is Vivian. Next time, my name is pretty soon is a part of my stuttering pattern. And Joe Sheehan used to say that you become a walking museum of all of the things that you've learned to escape from the moment of stuttering. This to me is struggle. This is not efficient communication, and it's learned behavior. It's learned and it's habituated very quickly because it goes on an intermittent reinforcement schedule, and intermittent reinforcement schedules become very, very strong. And so something that was once used to escape the moment of stuttering because you didn't want to show it at that moment, now becomes a habitual part of the stuttering pattern that even though you don't want to escape anymore, you're still using it. So in the arts program, we're all about eliminating it. We want to get back to what we call open stuttering, stuttering directly on the intended sound, stuttering openly and honestly. And then once you start doing that, it's at the beginning, it's not going to be real comfortable because you were spending all of your time trying to hide that, try to avoid that. So when you first start open stuttering, it's not going to be pretty. It's not going to be comfortable and forward moving. It's probably in our therapy, it's the milestone toward moving into facing stuttering when you're actually saying the word that you want to say and stuttering directly on it. So we take care of it in our therapy approach in two different ways. One, we take notice of them, start reducing them by watching them, monitoring them, and they reduce on their own. And then we try to replace it with true stuttering. getting on the sound and saying the word you want to say, putting the stuttering where it belongs on the sound that's feared. And so that's basically our attitude toward secondary behaviors. They were learned young sometimes, they were learned honestly, they were learned from escape, they were learned sometimes from management. So speech pathologists often give children advice. I call it advice because it's not therapy from my perspective. They give them advice to take a pause, to start over,
Take a deep breath.
take a deep breath, think about what you're going to say. I can tell you what secondary behaviors each of those lead to. It's very
That's right.
clear. Yeah.
When the person comes in, you say, okay, especially a young kid, someone must have told this kid X, because that doesn't.
Yeah. That inhalation pattern comes from taking a deep breath, and
It's not a respiratory problem. So like one doesn't need to learn. No, in all seriousness, a lot. How many people in the stuttering community, either through therapy or believe that therapy is about learning how to breathe properly and speak on exhalation. Now, if anyone would try to speak on inhalation, you would discover what Stridor is. We all speak on exhalation, right? So what would you say just about that? I can't ignore that question. Isn't stuttering a dysfunction of breath?
No, I don't think it's, as I say to my clients, if you weren't breathing correctly, you probably would be dead by now. So,
or you can come with me to the pulmonologist.
no, what happens is that because of trying to avoid stuttering, some people interfere with their typical breathing patterns that are very automatic. So
Self-regulated.
breathing problems don't cause stuttering. Stuttering leads to maladaptive breath support.
And that's a beautiful word, maladaptive. So there's adaptive stuff that's healthy. I'm thinking of David Shapiro, adaptations, and then there's stuff that's maladaptive. And the permission, going back to what you said, the permission for people to choose how they want to adapt, right? But with a mindful, deliberate idea of what's possible, what's necessary, what's efficient. So one of the things we do, and I'll close with this, I think is a nice exercise. I wonder if Vivian would like it. We help people explore and take an inventory of their own stuttering. What are all the different things that happen? What are the things that are visible? What are the things that are audible? What's going on inside? Just a full inventory. And then you could sort that inventory pile out into which of these are actually stuttering, which are the actual physical experience of stuttering, which of them are that reactive adaptation side of things, again, without judgment. And then what I find is powerful and subtle there is you start to identify, wow, these might be things I have no agency over. They're just part of me. And these things, I can make some choices. You know, these have become reinforced behaviors. And with some time, I can do some things that could have a different first nature or second nature about them. Would that be right?
Yeah, the only thing I would say about that is when you first meet somebody who stutters, you won't find their stuttering yet. And so it's very likely that you won't find the things to put in the category of this is something that I can't change, because it's so hard to find that until you peel away the layers of the onion. So much of the stuttering pattern in the beginning of therapy, it's all things that they've learned in response to it's hard to find that thing. And very often my clients
you're seeing the behaviors, you're seeing the reactivity, you're not seeing the stutter.
Yeah. And especially someone who's covert, you see nothing. You know what I mean? It's very rare to see, when I see somebody who I see some real stuttering we want to keep, it's usually because they've already had some therapy.
Mm-hmm.
And
I call it, raw, pure stuttering.
Or just stuttering on the intended sound, without trying to fix it, without trying to manage it, without trying to control it. And even those who are in therapy with me for a long time and we see control in their open stuttering, or we see prolongations in their speech, it's all control. So is that something we want to keep? Let's see the open stutter. Let's see the stuttering, in its raw form, and then let's keep that. So when we do our stuttering inventories at the beginning of therapy, we often separate it into the piles of helpful and not helpful,
Mhm.
rather than inside, outside, those kinds of things,
Mhm.
because they can put in a thought, that any thought that they write down, like, how helpful is that? And so we look at helpful and unhelpful in
Mhm.
terms of effective communication.
Yeah. Yeah. Awesome. Well, Vivian, this has been awesome. I just want to share with everybody, if you have one highlight, there's like a whole, I could think of probably 20 that I'm going to go back and re-listen to. This has been an absolute treasure trove and a treat. Thank you for taking the extra time. Thank you for everyone watching and listening. Share this, comment, send Vivian. Vivian, where can people contact you if they want to find you or reach out to you?
They can contact me at my email address at vsisskin@umd.edu.
Okay,
Easiest place to
great.
find me. I'm on email all the time. Yeah.
And I'll post this up to schneiderspeech.com/our blog with all the other 30 something conversations. And I'll include all of Vivian's bio and links to her clinic and to her practice. If you're interested in getting those free AirPods, you just go to the blog page. There's a raffle there. Very simple. Just send us the timestamp of which was your favorite talk and what was that highlight. We're going to put it together for an episode at the end of 2020. Together, we can squeeze out something nice, something sweet. And then if you want to check out the online course that we have, there's a coupon code GIVE, and that's available. And you can get 3 weeks to just run through the course and explore it to your heart's delight and see what's possible for teens and adults who stutter. This has been amazing. Thank you, Vivian. Next week, we have really exciting Dr. Derek Daniels, and also just on my good friend Justin Matley, who helped us produce the movie Transcending Stuttering and Going with the Flow, and also the online course. So I'm super excited. That'll be on Wednesday and Derek's on Thursday. But Vivian, nobody has brought out 200 people. So you are loved, and many miss you and appreciate that little kiss. And
Yeah.
I miss you, and I'm really glad we were able to do this.
And the only thing I regret from this is that I'm not able to see everybody. So I wish I could see all of you. That's the one thing that I miss. Yeah.
So we'll do like a virtual, everyone send Vivian a picture. We'll put it into a collage of this morning. Yeah, it would have been nice. The problem is there wasn't enough screen space.
Yeah.
I would need to get like a full, like, I don't know what, the whole wall would need to be a screen. But thank you for this. And yeah, it would be nice to see everybody, but at least to know that you're there and to feel connected and to keep the conversations going. We all benefit and appreciate that.
Yeah. It was great chatting with you, Uri.
Thank you so much. This has been great.